In this video, we will learn about the complications of insulin therapy. Hypoglycemic reactions are the most common complications of insulin therapy. They usually occur from inadequate carbohydrate consumption, unusual physical exertion, or too large doses of signs of autonomic hyperactivity such as tachycardia, palpitation, sweating, dizziness, tremors, visual disturbances occur in persons with intact hypoglycemic awareness. This may lead to convulsions and coma on treatment. Hypoglycemic unawareness is a dangerous condition in persons who experience frequent hypoglycemic episodes during tight glycemic control. These patients have no early signs of hypoglycemia. They may directly show the dangerous symptoms like confusion, weakness, bizarre behavior, and coma. Every diabetic person taking hypoglycemic medications should carry an identification bracelet, some cards, as well as some form of rapidly absorbed glucose. Now let's look at treatment of hypoglycemia. Hypoglycemia can be relieved by glucose administration. Simple sugar or glucose in liquid form can help the absorption. Dextrose tablet and any food or beverages containing sugar can be used in case of mild hypoglycemia. 20 to 50 ml of 50% glucose solution infused for 2 to 3 minutes is the treatment of choice for severe hypoglycemia. If IV infusion is not possible, 1 mg of glucagon can be injected subcutaneously or intramuscularly. If glucagon is also not available, small amount of honey or syrup can be inserted into buccal pouch. Oral feeding is not possible in unconscious patients. Other complications of insulin therapy include hypersensitivity reactions to insulin, which are quite rare now as insulin are made with recombinant DNA technology. Lipodystrophy can occur at injection site. This can be avoided by avoiding injecting the same site for multiple times.
Thanks for watching. Subscribe the channel for more videos.